Yeah, I'd like to call the meeting of the Employee Benefits Review Committee workshop to order at this time. Today's purpose of the meeting is to hear from Jessica Crosby, Partners for Health, as a Tennessee State Plan. Lisa, will you please call roll?
Yes, sir. Member Freitas. I got his name right. Member Phillips.
Here.
Member Claxton. Here. Member Holloman. Here. Member Smith.
Here.
Member Malott. Oh, he's here. Councilmember Feldhouse.
Here.
Councilmember Glenn.
Here. Here.
That's everyone, but you do have a forum there.
There's a lot of that.
It's just you unhook the blue thing on behind it.
Oh, behind
There's a
it.
cord behind it.
That'd be smarter than the way.
That's the technical, the blue thing.
Minute late, but it's all right. That brings us to public comments. Any comments from the?
No.
All right, the next order of business is new business. Partners for Health presentation by Ms. Jessica Crosby. Thank you for joining us today.
Thank you for having me.
Right. Well, we'll go ahead and get started. I'm Jessica Crosby. I'm the outreach director for Partners for Health. We are the state of Tennessee plan administrators for the state health plans. And so just a little background. We administer the plans for all state employees and higher education employees. And then, of course, local government agencies like yourself have the option to choose whether or not you want to be on the state plans or not.
Turn it off. So,
That would help. Okay, so a little bit about how our plans function. The state plan assumes all the risk for your claims. You pay us the premiums, then we turn around and pay the claims that way. Our premiums are just our premiums. So there's a lot of things that are wrapped in there. It's just one premium cost per month, and we'll get into what those are. I have them listed in the presentation and how the funding works, but any other fees you might be paying. So sometimes agencies pay for stop loss or supplemental plans or other things like that. So a lot of other fees can potentially be eliminated. Also, if you're outsourcing EAP benefits or paying extra for those are all wrapped into our premiums. So that's what the state plans can offer you as an agency. We're also continuously researching ideas for ways to cut costs, save costs. We're not brokers, we're state employees. So we're constantly trying to put money back into the plan design and to try to keep our premiums stable. And then just researching ways we can save costs and save our members money. So we offer 4 plan options for local government agencies. We offer the 3 PPOs and then the CDHP plan with the HSA account. So the PPOs plans function on a copay structure, and then they have deductible and then co-insurance depending on what types of services you're getting. And then that CDHP plan functions on the deductible and co-insurance structure for all the services on that plan. And we can share the comparison chart so you can see exactly line by line in network services versus out of network, and then exactly how much the copays are on each plan versus the co-insurance amounts and things like that. It also lists the deductibles for each plan. It's just a lot of information in one chart, so I didn't want to throw it on the slides, but we do have that available that I can share with you guys as a resource to look at the plans. It's a really nice tool to compare the plans side by side, but we do offer those 4 plan options. Now, not every employee has to choose the same plan. In fact, every employee can choose a different plan. Everybody can choose the same plan. They do have to be offered all 4 plan options. Okay, so once they pick their plan right, based on, okay, here's my deductible, here's my max out of pocket, that's good for myself and my family. Here's what I'm going to pay for my copays. They know that. They know what services are covered, right? The covered services are the same across the board for all 4 plans, but the copays vary, right? The max out of pockets, the deductibles vary. So once they pick their plan, then they would have to pick their carrier. So our carriers until 2029 are Blue Cross Blue Shield and Cigna. So there's no differences in the plans and what they cover based on the carrier. The differences are with the networks, which is that bottom chart portion. So we have the 4 plan types, and then their service. These plans are serviced by the 2 carriers, either or. Okay. And then each carrier has 2 network options. So our basic networks are the Blue Cross Blue Shield Network S, and then that Cigna Local Plus. Now, it's my understanding you guys currently have a Blue Cross plan, and are you on Network S?
I believe it.
Yes.
Okay, so the good thing about that is the networks are universal, so your Network S is our Network S. So as far as the networks, what we're talking about there is your doctors, your specialists, the facilities, the hospitals. So all of those would be in our same Network X. But your employees would have the option of choosing that Cigna Local Plus. And then we also offer those 2 enhanced network options, which is Blue Cross Network P and then Cigna Open Access Plus. And you will see a bit of a surcharge on those networks because they are an enhanced network. And really the big difference there is the HCA group. Are part of those networks. But if you guys are on Network S now, then all of your doctors, facilities, providers are in ours. So here are the premiums. I know that chart is really tiny, so of course I'll send you, I think I've already sent, the slide deck, but we can send you the actual chart. It's posted on our website. I think a couple of you have already looked at it and kind of done a comparison with your current premiums. And so the one thing I wanted to point out here is the way you choose to fund the premiums is completely up to you. So you decide the employer split. So the state does an ACH debit on the 15th of every month, and we're just deducting that full premium based on whatever plan, whatever tier the employee chooses. But how you fund it is up to you, right? So it can be different by plan. It can be different by tier. You can fund more towards employee only if you so choose, or, fund it differently than the way you fund the employee plus child, employee plus spouse. We do not have any spouse restrictions on our plans. That would be up to you guys, but spouses are able to join. And then, again, just how you fund the network options too, those ones with the surcharge, you can pass a surcharge along to the employee if they want to get that enhanced network option. Same with the plans, right? So if you can give a set amount, say, hey, we're going to give you $624. That'll cover the local CDHP plan and most of the limited PPO. And then if you want another plan, you'll have to pay the difference. That's fine too. So it can be a set amount or it can be a percentage. You can say, hey, we're going to pay 80-20 on 2 of these plans, but then on 2 of them, we're going to pay 70-30. But you're in control of the funding of these premiums. It is one set premium. These are 2026. They run January through December. It's calendar year premiums, calendar year plans. So that's important because the deductibles, max out of pockets, and everything resets January 1. And then, so the state, we have an insurance committee, if you guys didn't know that, that determines these premium rates, okay? And so they will actually meet, so these are set, right, for January to December 2026. They'll meet around May and determine the premiums for the following year. And so that's one thing about the state. Health insurance is just expensive, especially right now with everything going on in just the industry and healthcare as a whole. But the one thing about the state premiums that's nice for local government agencies is the stability of the premiums year over year. You're joining a large risk pool. We have over 300 government agencies on our plans. We cover 300,000 lives across the state. We have about 100 cities and towns on our plans. So we just have a very large risk pool. So that spreads the risk out, and then it also helps with the stability of the premiums. Now, I'm going to go quick over this slide because this is actually the local education increases. I noticed on the presentation the wrong slide got put in there, but I have the local government. I pulled that and I've already updated the slide, so when we post or send it out, we'll have the correct But just to give you an idea, the last few years, so this past year going into 2026, these premiums that you see here on the screen, that was a 7.7% average aggregate increase over 2025. The year before that, it was a 1.6% increase average aggregate across, all plans. Before that, it was 3.5. Before that, it was 7.5. And before that, it was 4.4. So you can just see over the years, the stability year to year. You're not going to see those double digit premium increases, or God forbid you had a high cost claim or, something like that with your employee base, you're not going to see those skyrocketing, premiums that we see sometimes local government agencies. They may leave the state health plans, or they may be considering another option because, someone may come in and say, hey, I can beat those premiums, but then year 2, year 3, it's not as much of a cost savings, or you see a pretty big increase. So just be mindful of that. The one thing to keep in mind about, our premiums is that the stability that the state health plans provides. And I'll get that slide updated so you can have that in your slide deck. So just a little bit, we talk a lot about medical, and and that's the big win with health insurance is your medical benefits. But there's also so many other things that come along with the state plans, and so many other benefits that are included that I wanted to share with you guys. And I'm going to go a little bit quick through some of these. We can get more into them, of course, if you have questions about any of them, but really just the state wants to provide total health care for the employees. Physical, emotional, mental health is so important. And also, all of that impacts our physical health too. And like how many times we're going to the doctor, or managing chronic conditions, or anything like that. We're not proud of our Tennessee trends and statistics there. We're 8th for highest obesity, in the top 2 for percentage of smoking adults. So we really need to be focused on, our healthcare and self-care just as a whole. So these are some things that are included in the premium. So our EAP benefits are now referred to as emotional well-being solutions. So you'll see that as EWS, but it includes personal services, legal services, child, family, and parenting support. There's a plethora of benefits that are available through the Here for TN program. And some of these benefits, like we'll get into here, 5 free counseling sessions for you and your eligible dependent per topic per year, that are included, and at no extra charge. You can also have 2 free calls with a money coach. A lot of times you talk to someone about your financial portfolio and they're like, yes, I'll help you, but I'm taking a percentage of it. And so these are just some benefits that are included, right, that you don't think about using your health insurance for, but they come along with being on the state plans. There's training programs, there's critical incident response services, there's manager resources for workplace issues. There's just a lot of benefits that come with that Here for TN program. Here's a couple more just to call out. I mean, again, there's just a lot more benefits, but of course we do virtual visits and Talkspace online therapy where you don't have to go into someone's, office and sit on a couch. You can text, you can video chat, you can do it at your convenience. And you don't even have to have a set appointment with them. You can chat with them back and forth throughout the day when it's convenient. There's Calm and Calm Health to manage stress, better sleep. If anybody's sleeping great, we need to talk after, because I feel like, you get to a certain point and it's got to be the right temperature, the right clothing, the right environment. Everything's got to be the way it has to be. But anyways, helping with better sleep, a happier, healthier you, will all take a little bit more of that. And then, of course, our Take Charge at Work program, work-life balance. So this is what I was talking about with the legal mediation. Financial included, no extra charge, a 60-minute telephone or in-person consult with a lawyer. Lawyers are very expensive. And then, of course, ongoing representation at a discount if they so need it. We put together Know Your Health, which is a newsletter. Health insurance can be complicated, and nobody really wants to hear about it until they need it. They don't really think about it until they have to go use it. So we put this together to just make it easy for our members to understand what is an EOB. When they get that in the mail and they're like, this is not a bill, okay. And what does that even mean? Sometimes it can look like foreign language, just helping them understand their benefits and health insurance. A lot of people, you're like, what plan are you on? They're like, Blue Cross Blue Shield. well, that's not really your health insurance plan. So we just want to help them understand and make it easy for them. So we put together all this. We have a team, a wonderful team of communication experts that put these newsletters together for our members. Questions to ask if your child has a new diagnosis and you're like, I have no idea what this is or what to ask or what steps to take. We put all that together for you guys. And that's available. We also have cost transparency tools because at the end of the day, we just want to know how much are we paying, how much is coming out of our check, how much are we going to be responsible for. So this makes it easy, as you see, for a knee replacement. You know, of course, it's just an estimate. A lot of it depends on, you know, your personal situation and how much of your plan you've used and all that. But it's a great way to estimate it, to get an idea, right, of what you're going to be responsible for. Sometimes it's like you're going to get a procedure and you're kind of in the dark as to what you're going to be responsible for. So this is an overview recap of all of our included benefit extras. We have a diabetes prevention program that will help you if you're on track, if you're having issues with your blood sugar or insulin, but you haven't quite been diagnosed with diabetes yet. Prevention program, that's a great tool for our members. We offer Hinge Health and some personalized exercise therapy programs where they ship you the equipment that you would need or the bands or whatever, and you can do it at your house. There's a Cigna Bone and Joint program, which I know a lot of your people are on Blue Cross Blue Shield. And so what we see a lot of times when we onboard agencies is people just want what they had for the first several years. And then, you know, as we get along, sometimes they get a little creative and want to go with another carrier or a different plan type or something like that. But the Cigna Bone and Joint program is also a great benefit as long as the PPO members, if they're on a PPO plan, if they use one of the approved providers, they're paying nothing out of pocket for those procedures. We also offer behavioral telehealth. We have behavioral and substance use programs, waive treatment costs, and we have a lot of great discounts and ways that people can save money. Another thing you'll get access to being on our state plans is our wellness program. That's managed through ShareCare, and they have a plethora of programs and personalized coaching and real age tests and resources to manage your health, and it functions like any typical wellness program that you're used to. But there's motivational content, and like people can actually select what they want to improve, whether that's weight management or sleep or whatever, nutrition. Nutrition advice is very expensive these days, and it's all over the place. It really needs to be personalized. So they take the time to really personalize it to your body, your lifestyle, and what works for you. And then just a little fact, you get access to our state employee discounts. This is kind of random, but you guys would now get the same state employee discounts that we get. So that's your big box retailers like Costco, Enterprise. Movie tickets are on there, discounted. Why is it $20 to see a movie now? I don't know. But they're normal prices on our discount site, which is nice. And then there's also local, you know, Dollywood tickets are on there, local Tennessee stuff that your employees would get a discount for. Okay, so we offer our medical plans, and you would have to decide to come on to our medical plans. We would just need a 60-day notice, and you can come on anytime throughout the year. Of course, that January 1st is most ideal, or either middle of the year, because of the deductibles and max out of pockets running calendar year, right? January to December. But we can bring you on anytime. In fact, we have agencies that come on just about every month of the year across the state. So anytime, y'all just let us know. But you would have to come on to our medical, and it would be a 2-year commitment. You have to be on the state plans for 2 years. And then if you chose to leave, we hope you don't, but if you did, you'd have to be gone for 2 years before you could come back. And usually people do want to come back. So just keep that in mind. But I say all that because you come onto our medical, and that's your 2-year commitment, but the dental and vision are optional. So you don't have to take our dental and vision, or you can take both, or you can take one or the other. So one, both, or neither. And you can also add dental and vision later on down the road if you wanted to come onto our medical plans and keep your dental and vision where they're at, you can do that. And then if you're on our medical and later on down the road you wanted to add, you can also do that. So just quickly, a little about dental. We offer 2 plans. One is administered by Cigna. It's a DHMO plan. It functions like you have to select your dentist, right? That's in the network, and then you have a patient schedule charge sheet, and then you have your DPP plan, which is administered by MetLife. It is now Delta Dental this year. If you've seen any of our dental information out there, it is changing to MetLife in 2026. Same plan, it's a DPPO plan. You can pretty much go to any dentist, and our rates are there on the screen. You can, same thing, you can have the employee pay the full dental premium if they want dental, or you can supplement it however you choose. It can be different by plan, it can be different by tier. Vision, we offer 2 plans through IMED. There's a basic plan and an expanded plan. They're both administered by IMED, and I have our vision rates too. I can send you guys, same thing with those, same with the funding. The premium is just the full premium. You can supplement it however you choose. It does, both plans, of course, cover that routine eye exam. The basic plan pays for your eye exam after you pay that $10 copay. And then on the expanded plan, of course, the annual eye exam does not have a copay. So for our interested agencies, I know we briefly mentioned this just a minute ago, 60-day notice. We would need a couple documents completed, so an intent to enroll form, an ACH form with a voided check, and then your retiree selection form. So you would have the option to provide retiree, pre-65 retirees health insurance, the option to continue coverage at retirement. Do you currently provide anything for retirees?
Yes.
Start 60, you keep to 65.
Okay, so we can talk about that in the provisions of our retirement insurance or whatever, but you'll have that option to do that, to continue to cover the pre-65 retirees until they become Medicare eligible or turn 65. And so how the process would work is you guys would let me know that you're interested in moving forward, and we would complete those documents. There's also an MOU agreement that just details out the agreement between the local government agency and the state. And from there, we would just work on getting your agency process, getting it set up in our system. And then you would transition to our onboarding and enrollment process. We have a whole a wonderful onboarding and enrollment team. You would be assigned your own specialist that would come and help. One, we would start with employee education sessions, because even though you're on a Blue Cross plan now, the state plans obviously are a little different. And then also we offer more plan options. So we would come and teach your employees about the plan options, and they can bring their spouses or, have some time to go home and talk to their families about what plans would work for them. Then we would circle back and come back and help with the enrollment process and get everyone enrolled in their plans and help with the documentation. We would train what we call an ABC, which is the Agency Benefits Coordinator. That would basically be our liaison between us and you guys. And we would train you in all of that on our processes, on our software system and all of that. And then from there, once you're enrolled in the state health plans and you're effective 1/1, everybody has their cards, they're ready to go to use their plans. Then from there, you guys would just become a state agency, and then, or a state participating agency. And then you would participate in our annual enrollment every fall. So from there, so you're enrolled and everything 1/1. And so usually in October, we have an annual enrollment period where people can go in. It's a passive enrollment. So if they're happy with their plans, they don't want to make any changes, they do not have to take any action. But if they want to make changes, they'll be able to do so during that period of time, unless throughout the year, if they have a special qualifying event, a marriage or something like that, they're able to make a change then. So that's how the process works. And I know that was like a very high level overview of our plans and everything. What questions do you guys have for me?
Is there any fourth quarter carryover for out of pocket?
So no, they do not. So like, are you saying if they've started meeting in the fourth quarter, no, it automatically resets every January 1.
Okay. Second question I have for you was about your premiums. You talked about the ability that you've had those premiums pretty steady as far as from going up and that kind of thing. but also is there any truth to the fact that you've been offsetting the premium cost with federal money? And if so, is that federal money now running dry, and so the premiums are gonna probably go up exponentially as a result?
As far as like federal dollars, I'm not aware of anything. I can definitely ask our finance director if they're aware of any federal dollars. But to my understanding and my knowledge, what we do is we collect the premiums and we keep a very financially solvent accrual account, and we don't let it dip below a certain amount. And so they monitor that constantly. And I don't think it's getting funded by any federal dollar, which I can ask. I'm not sure about that, but no, it's not running dry or anything like that. We keep it at a certain amount and we adjust the plan design. So that way, you know, we're compensating somehow, some way to make sure that if we're making an adjustment in the premiums, we're adjusting the plan design to balance out to make sure that the plans stay financially solvent.
Is all Blue Cross Blue Shield, the Network S, is it the same?
As yours now?
Yes.
It is.
Okay.
The networks are universal. So yes, if you're on Blue Cross Blue Shield Network S now, it's our same
Same
Blue
thing.
Cross. That's
So you're
right.
comparing apples to apples.
Well, on the networks, yes,
Okay.
just not the plan. So the networks encompass like your doctors, your specialists, your
Right.
hospitals, all of that would be in network for you. That's in network for you now, would be in network for us.
Okay.
Now the plans would, you know, the plans vary, but the networks
Okay.
are the same.
So if you have a procedure done in October or November of the year, those deductibles or co-pays or whatever you've done then do not carry over to the next year.
That's right.
Okay.
So,
Our plan does.
okay.
I believe. Am I right?
That's right.
Did you have a question?
Yeah, I was just wondering, is the state pool, is the education pool separate from the other people pool?
It is.
Okay.
Well, it's actually three. So we have the state and higher ed, we have the local ed and the local gov, and they all have their own, our finance
So
team
we would
manages
stay in the local government.
in the local gov, that's right.
Who is your Cobra carrier?
I don't think we have a Cobra carrier. It's the same plans. It's us. We take over all the Cobra
So
administration.
that kind of making sure it didn't change. And then, like if new employees come on, do they go online to enroll or how do they do that?
So, they can either go online through Edison. So what I was mentioning earlier about training the ABC, you guys would be trained on how to input the selection into Edison, which is our software platform. You guys would have access to that. So employees can do an employee self-service and make their selections online that way, or they can fill out a paper form, either or, and we submit a ticket. So that's one thing I failed to mention. Is we have a dedicated service center of state employees. It's about 75 of us that answer tickets, direct phone calls. You can call into our call center and or email. You can even text the email address and it generates a ticket in our system. And they're very responsive. They have over a 95% satisfaction rate and anything like that. So like if it was a paper form, we would just submit it to create a ticket and we will process it that way.
I've got a question. If we had a new hire come on, say the 28th of the month, their benefits go into effect on the 1st of the following month. So if they went online and signed up on the 28th, would that be immediate in the system where they would show up if they had an appointment on the 4th of the following month and, you know, and cards and all of that, how quickly that process would be?
So if an employee is hired, for us, they are eligible the 1st of the following month. So yes, they would have coverage. They may not have their cards, but they could go ahead and use the plan. And they can most likely go on and get that digital card, but they'll have their plan and everything the 1st, as long as y'all don't have a probationary period. That's up to you guys. But for us, yeah, if they're hired, you know, anytime throughout the month,
That's how.
the 1st of the next month, yeah.
And if they're hired on the 1st, is it affected that month? We have that sometimes.
So it's the 1st of the following month.
So if they're hired on the 1st, it would be the following.
I believe so. I'll double check if
Okay,
they're
that
hired
one-
on the 1st.
that
If they're hired on the 2nd, is the 1st of the next
Yes.
month. But if they're actually hired on the 1st, I'll ask about
It
that.
does happen.
Yeah.
Any more questions? Any questions from the proxy representatives?
Scott, I got it. Go ahead, Jimmy.
You said there was a tool on your website somewhere where we could compare our existing plan to your plan, it would give us a side by side, did I hear that at the very beginning?
So it's not your plan or our plan, it's just our 4 plans side by side. However, if you want to send me a copy of your plans, we can put together like a side by side comparison. It may not line up 100% because we might cover more stuff than you cover, or you might cover something that we don't cover. But I can pull it up, or he's on the website. So if you want to go to, or do you want to give me the mouse, I can drive it, or you can go. Okay, go under health options. Sorry. And then you scroll down.
There's a COBRA sheet over.
Actually, they'll have stuff on pages.
That's how Blue Cross administers everything. I just wanted to make sure, like city owned.
And then 2026 health, but make sure you. Yeah, that's the chart. So if you pull that up, perfect.
I'll stick it up. Stretch it out.
So, okay, that's the compare. I know it's so small, that's why I didn't put it in the, but when you print it out and look at it on paper, or you can look at it on a computer and zoom in, it really does make it easy. The reason why there's so many columns is because it's showing in-network and out-of-network benefits, but you, of course, want to make sure you stay in network and all your employees stay in network, because that's the most cost efficient and effective way to utilize your benefits. So this compares our 4 plans side by side, the Premier, the Standard, the Limited, and the local CDHP with the HSA account. So you actually get an HSA account automatically opened when you choose that plan, and then you guys can contribute to it for the employee can contribute to it or not, and they can use that health savings account to pay for like their doctor's visits or any medically approved expenses. They can use it for prescriptions. They can actually use it for approved over-the-counter items as well. I put my contact solution on mine. So just things like that, they're able to use that health savings account for.
I have one additional question. When we spoke to Blue Cross, they touted this as one of the best things that we have about our insurance was the cost for specialty drugs. As of right now, it shows our cost at $140. But under all of your plans, it shows 30%. Now, if these are specialty drugs are $9,000 a month, 30% of $9,000 is a lot more than $140. So, how does that work? Is the 30% exactly what it is that you offer? Are there any deviations from this that we can tailor make for our program that would maybe offset the fact that 30% is way more?
Sure. No, so like it's set for all local government agencies, that specialty drug line. But what we can do is if you have anyone on a specialty medication, we can look up the cost ahead of time for each plan because it may vary based on the plan, and it also varies based on how much of their deductible they've met. But the specialty drugs, really, what's driving that is the GLP-1s. Like the Ozempics, the Wegovys, Mounjaro, those items. Now, if you are diabetic and need those for diabetic purposes, they're covered. They're actually still covered on our plans too for obesity. You just have to get, prior authorization and things like that. But yes, that 30%, we would have to go in, but we have the drug cost tool that we can look it up ahead of time before they select a plan, or even before y'all decide. If you have a couple people that are on certain specialty medications and you're concerned about that, or if your family is, then we can look it up ahead of time before you even make a decision on if you want to come to the state plans or not. So we'll be able to look that up.
Do your prescriptions count towards your overall deductible?
So if you scroll down a little bit to the, right there, the out-of-pocket max. So yes, it counts towards your out-of-pocket, it's set for the specialty. This year, the specialty has a separate out-of-pocket max, because what was happening was, people would go and pick up a prescription, and it was, ghosting the out-of-pocket max based on the manufacturer coupon, so they were getting credit for, their max out-of-pocket on a specialty drug for money that they weren't actually paying out-of-pocket. So we separated it out to have a specialty out-of-pocket max, but yes, everything else, prescriptions, there's not a separate deductible or out-of-pocket max for prescriptions.
How would you compare, I mean, right now we have, is it a broker? Is that what we have?
Yes.
Compared to what you guys, to me, it sounds like if we're in with, if we chose you, we're part of membership. With the broker, they're just, seems like cut and dry, this is what we're gonna do, we're only gonna do insurance. It seems like yours is pretty expanded and offers other benefits. How would you compare the two, broker to who you guys are?
Well, it's just different, right? So like, if you're paying a broker, I'm sure you're paying broker fees or some type of additional fee for them to manage the plans for you. I assume, I don't know, I'm not a broker. We're not brokers. But they typically have some type of broker fee, commission fee, something like that, some type of fee that you may have to pay in addition. I don't know about the brokers that presented here, or whatnot. The other thing is sometimes when you're going through a broker, they help you like with the administrative side, right? So we would do that instead of them. They come out and help maybe with enrollment or something like that. That would be the state instead of them. A big difference with being self-insured and not is what you mentioned earlier, is like if you wanted to do a special, a difference in specialty drugs for your group, that would be something your agency would have to bring to our insurance committee to ask, to try to get the plan design updated for everyone. You can't make personalized adjustments for your agency only. Does that make sense? So like when you're self-insured, you can adjust plans or work with them maybe to make some adjustments in the plans. Whereas we have a team of people that work on our plan design for everyone. Now we do take member feedback. So, we do focus groups, we listen to our members, we see the tickets, we analyze those, what's coming in, what are people asking for, what do they want covered, stuff like that. But that's basically the big differences,
Let me ask it in a different way, because I want to be fair and I want to make sure it's apples to apples from the other meetings. What makes you better than a broker? What makes the state insurance better than just going with a regular broker? What is the benefits of going with this versus the other? Because from others, we heard how the state was bad and they were better. And so I want to make sure that you have the opportunity to say why you might be better versus the other.
Well, I'm not here to say they're bad or good, bad, or indifferent. I mean, we are the state, so we're unbiased. I'm a state employee. We're all state employees, so we don't, we're not brokers, so it's hard to say one is better than the other. Of course, I'm biased to the state plans. I'm on the state plans myself, and I work with several agencies, and of course, we want to serve all of Tennessee for sure. Just because the state plans are just a little more stable. It's a great plan. You cannot match the state benefits. It's a custom design plan. I know we haven't analyzed the coverage and everything for all of your current plans versus our plans, but it's a custom design plan that your agency cannot go to Blue Cross Blue Shield and say, give me the exact plan that the state is offering, because they can't match it, because we have custom design plans for the state. That's one benefit. The other thing is the premiums. I know it's expensive. I know seeing $600 per employee in the family plans, it's expensive. But the stability, that's the one thing, year over year over year, you're going to know that the benefit, the premiums are going to be stable, to where you're not having to scramble at the last minute because you get a giant premium increase and you're like, oh man, we have to switch. So those are the better things about the state plans. And then again, we're just state employees. So
thank you. I just wanted you to have that.
Yeah. Well, thank you. Thank you for that. But no, I'm not up here. We actually partner with, you know, brokers in some capacity because we don't offer, you know, STD options, life insurance or anything to at a local level yet, hopefully soon. But we offer medical, dental, and vision. So a lot of what I do is kind of side by side with brokers, and we have great relationships with them. And even TML, we exhibit at their conferences where, you know, it's great. Kevin used to serve on our insurance committee. So we have great partnerships with everyone throughout the state, and I'm definitely not here to say anyone is bad or worse or one decision. You guys do your due diligence, and I just want to present all the state information so you have it, so you can make a good decision for your agency and your people. So that's all.
Any more questions? Thank you very much.
Yeah, thank you all.
Thank you. Great presentation.
Thank you.
We appreciate that.
Yes.
Before we adjourn though, we need to talk about our next week schedule. I know we've had information from all three presenters. We need to have them study on it. However, there's a scheduling conflict with our next Thursday meeting. Trevor is going to be out of town. I'm going to be out of town. So what's the committee's preference? I mean, they could act as chair, or and y'all continue on, or we can.
I don't think we got everything back.
Yeah, when we got the numbers from TNL, yeah, until we have more information, we're kind of,
To me, I think next week might be too soon to even have it anyway, if they take until next week to get it, so.
Yeah, I wouldn't be able to schedule them at this point for next week, and I know that information they asked for was a lot, and it's gonna take us a little bit of time to get it together for them. And, Blue Cross Blue Shield actually sent me an email yesterday, or maybe the day before. They would like to come back and give you options for different plans through them.
Do you think that we could set up something for the 24th, which is the following Thursday? Or is it the 23rd?
23rd.
I think it's the 23rd, sorry.
Well, we have our meeting set for that day anyway, so I can try to see if they can come that day. If they get their information back in time, yeah.
Okay.
We can do that. So just not have a meeting next week at all.
Do you have a, we'll pass
It's supposed to be nice weather next week, so. I got a lot of.
you got some concrete for
I
it.
got a lot of.
So no meeting next week.
Any additional questions or comments for the committee from Roxy?
Just thank you for setting this up and having the representatives come in. I think this is definitely great direction.
I'm also excited that even after this, that you had mentioned that this is going to turn into employee pension discussions. And I'm excited for that portion of it as well.
Yeah, I think this is a committee that's going to keep on rolling. Well, if there's no further comments, we'll declare the meeting adjourned.